How do I know if I need a tummy tuck or just liposuction? I'm Dr. Victoria M.A. I'm a plastic surgeon in Scottsdale, Arizona, and I hear this question a lot from my patients. So let's first start with, these are two separate procedures. They have two separate goals and two separate indications. Let's start with liposuction. Liposuction is just removing fat cells. So basically we are removing fullness or making a smaller version of you. This is best indicated for patients that have some extra fullness and have pretty good skin tone or not a lot of laxity. That's usually the best patient for liposuction. Another good patient for this operation would be somebody that has some fullness and they maybe have some skin laxity, but they're okay with that. They're okay if that skin laxity gets worse. And oftentimes these patients don't want a tummy tuck because they either don't want to undergo general anesthesia or they don't want the scars associated with the tummy tuck. As long as they're okay with having some skin laxity, then they're okay to just get liposuction. Now, a tummy tuck patient, typically that addresses two different things. Typically we tighten up the abdominal wall muscles that get separated during weight gain and weight loss or pregnancy. And we also remove any of the extra skin that's over the lower abdomen, and we redrape the upper abdomen skin. So we pull it all the way down, gives you a nice taut and tight tummy. That is a full tummy tuck. Now, really, a lot of patients fall in the gray zone in between. And what do we do with these patients? So first of all, this is a very personal discussion that you need to have with your plastic surgeon, because it really comes down to what bothers you, what the goals are in terms of what surgical outcome you want, and what you're willing to accept in terms of risks and scars. So typically if I have a patient that has a little bit of fullness and some skin laxity, but not a total overhang of skin laxity, they will often ask me this question: which one should I have? And I will ask them back, are you okay with having skin laxity? Because if so, we can just do liposuction. If you're not okay with that, oftentimes they'll say, well, can I have a mini tummy tuck? I will tell patients a mini tummy tuck, think of that like a little bit of an advancement of a C-section revision. So this is best for patients that have a little bit of an overhang over existing C-section scar. Basically, we're going to remove that and make it a little bit more smooth. The scar is still usually on the inside of your hips, so it's not too short. We don't usually tighten any muscles associated with that. That's a mini tummy tuck. The other thing is, a mini tummy tuck is going to remove the lower skin on the abdomen and pull everything down. So if a patient has a belly button that rides kind of low, it will only accentuate that. And I'll kind of model that for them in the clinic by pulling down their lower abdomen. Now, if you have a high belly button or a belly button that's looking in a normal position, that's not as much of a concern. How do you know where a normal belly button sits? It's supposed to sit right at the top of your hip bones, basically. That's a normal belly button. So a high or normal belly button is a great option for a mini tummy tuck, as long as you just have a little bit of skin overhanging a C-section scar. A full tummy tuck, on the other hand, will accomplish the muscle tightening and the removal of the skin laxity. And this is best for patients that have skin laxity around the belly button, because we can address that entire area with a full tummy tuck by dissecting all the way up to the top of the rib cage and redraping the tissue all the way down. That is not something we can do with a mini tummy tuck alone. So it's not a perfect answer, but really it comes down to what bothers you, where the issue is. So again, skin laxity all the way around the belly button, just overhanging the lower abdominal area with the scar, like a C-section scar, or if it's just fullness and you have normal skin laxity, or you're okay with having extra skin laxity if we remove some fullness. And then what are you willing to accept in terms of the anesthesia that you have to undergo? So general anesthesia versus local anesthesia, and what kind of scars you're willing to have. So a full tummy tuck scar or just liposuction port scars. It's a very personal discussion, and I encourage you to have it with your physician, with your plastic surgeon, so that you know what to expect and you pick the best surgery for the outcome that you want. And hopefully that helps answer your question.